title of Tim's keynote is Research and Practice. What are the questions which need to be addressed for the future? Thanks, Tim.
Hello, everyone. It's very exciting to be here at the launch of our new organisation, and I'm honoured to be the first presenter at our inaugural conference. My topic today is Research, Practice and Policy, an Agenda for Early Childhood Intervention in Australia. And I want to begin by acknowledging the traditional owners of the land on which I live and work, the Boonwurrung people of the Eastern Kulin Nation, and I pay my respect to their ancestors and elders, past, present and emerging. We have decided to dedicate this presentation to the memory of one of our number, Janene Swalwell, a long-time ECI colleague who died suddenly in May last year. Janene was an indefatigable champion of early childhood intervention services, a constant innovator, a mentor to many early childhood intervention psychologists, and a valued colleague to me and others for over 40 years. She was a member of the group that originally began planning to establish PRECI. In fact, our starting point was a paper that Janene and I had written 20 years earlier on the need for an early childhood intervention research institute to give the sector a stronger evidence base. And Janene was the one who came up with the name of our group. We are the poorer for no longer having her with us, but we welcome this opportunity to pay tribute to her great contribution over many years. The aim of PRECI is to provide a forum for linking early childhood intervention researchers and practitioners in a way that we haven't really done before. So what I'm going to cover is I'm going to look first of all at forms of evidence, then at the research agenda, a practice agenda, and also some policy issues we might be considering. I'm going to start with the forms of evidence. There are many different forms of evidence, but we tend to privilege one above most when we think of what evidence is. I would argue that there are a variety of forms of evidence that are relevant for early childhood intervention services. Here's my list. Biological and developmental evidence, what we know about how children with and without disabilities develop and learn. Socio-ecological evidence, what we know about the factors that shape family functioning and development. People's lived experience, people's direct experiences and views about what matters to them. Service delivery evidence, there's convergent evidence about effective ways of working from a variety of different disciplines and sectors, and which tell us about how to work effectively with families. Published research findings. This is the one we usually think about. Evidence-based practice based upon randomised controlled trials and systematic reviews as the ultimate form of proof or truth. However, there's also practice wisdom, what practitioners know about what works with particular families and contexts. There's also First Nations and other belief systems, alternative to Western positive science and cultural assumptions, increasingly coming to the fore in recent times as we try to understand how it is important for us to understand these different belief systems and what we can learn from them. Finally, there is data, not only in the form of audits and evaluations and outcome measurements, but also in the form of direct, immediate feedback from families. All these forms of evidence, I suggest, need to be brought into play when we are considering seeking answers to research questions. So what are the research questions? What follows, the research areas that I have identified are not framed as specific research questions, but as broad areas requiring further research. And when we come to look at them, we're going to need to become a lot more specific in the questions that we ask. Moreover, I'm going to be talking about generic early childhood intervention research issues, referring to ECI in general, not to specific discipline or disability-specific research questions, mostly. Also want to point out that not all questions can be answered by science. And science itself is not a value-free exercise. The case in point is the current debate around identifying a category called profound autism. One of the speakers in the panel that follows this session, Andrew Whitehouse, had a piece in The Conversation a couple of weeks ago on this very topic. But whether there should be a category of profound autism is not a question to be answered by science. It's a policy or a values exercise. And indeed, many of the questions we address have values attached to them that we need to unpack. With these caveats in mind, what do we need to know about children with developmental disabilities, their families, supports and services? Here's my list. First, how early should we start early childhood intervention, and what form should this take? Starting early is one of the key principles of early childhood intervention. We believe that the earlier we start, the better. The rationale for this is clear. The early years are the most developmentally plastic, and experiences and exposures during that time can shape development and well-being across the life course. So the sooner that we can ensure that the environments that the child is exposed to provide them with the experiences and exposures they need to flourish, the better. However, although some developmental disabilities are detectable at birth or before, e.g. Down syndrome, or early in infancy, e.g. through infant hearing screening, others only emerge in time. There's ongoing efforts to improve early detection and lower the age at which early childhood intervention support can begin, with partial success. Although one of the unfortunate effects of the NDIS has been that the average age at which children have accessed early childhood intervention has actually risen. We've got new techniques coming on stream, such as whole of genome testing, and that may identify those who are at genetic risk of certain conditions. But the fact remains that the majority of developmental disabilities occur during pregnancy and are therefore present at birth. So what are the implications of a condition like autism being present at birth? In what way can it shape the early development of the caregiver-child relationship? And if we were to start at birth, what form of intervention would be most appropriate? Again, Andrew Whitehouse and colleagues have been using a combination of risk factors to identify children who are not yet demonstrating signs of autism, intervening at 9 or 12 months to see if they could, what effect that would have. This is great research. Here's a model which shows a bit about what they're doing. We look along the bottom, we've got conception to 6 months old, and then the emergence of symptoms and the consolidation between 6 and 18 months, followed by a clinical diagnosis. Andrew and colleagues were intervening during this pre-symptomatic intervention window to see if they could reduce the incidence or the level of autism ultimately experienced. But I'm really interested in this period here. What can be done in that space? These are research questions, I think, ahead of us. A lot of great work being done. Another research question: how do families experience the universal and early childhood intervention service system? We need to know much more about the family's lived experience of our services and our service system. There have been plenty of studies of parental experiences of services and plenty of accounts by parents of raising a child, but that has not been collectively done in a way that is really helpful. We need more studies of the impact of different factors, conditions and services on parental development and family functioning. And we need a better understanding of the pathway that Australian parents follow from birth of the child to having concerns about the child's development and then to accessing specialist services. I suggest that lived experiences that is what we need to be drawing upon. Another research question is, what impact do different forms of early childhood intervention have upon family functioning? The efficacy of our services are usually based on child's developmental outcomes, but families are also developing during this period. The child is shaping as well as being shaped by the family environment, especially the parent-child relationship. And we need a better understanding of what aspects of service delivery shape parental and family functioning in positive ways and better ways of measuring positive family functioning. Another question, what's the relative effectiveness of home visiting versus clinic-based services versus group work? Our best practice guidelines have answered that question. We think that home visiting is preferable. The rationale is much stronger. The evidence indicates that direct therapies are less effective with very young children. But as it currently operates, the NDIS offers perverse incentives for ECI services to provide direct therapies. So we need more hard evidence regarding what is the most effective form of service delivery. Moreover, when we present the argument for home-based services to countries that have no tradition of such support, it's likely to be challenged, as I found out in some recent work with Abu Dhabi, where immediately we said that home-based services are the way to go. They said, what's the evidence? Wasn't immediately evident to them at all. How effective is telepractice compared to face-to-face services? Another major research question. One of the benefits of the pandemic was to force us and other service sectors to use telepractices to deliver services. But how does it compare with face-to-face or with whether it's clinic-based or home visiting? There was some ECI-specific research on these questions before the pandemic. More is emerging and more is needed. Another question is, what impact do different goals have upon outcomes? I would suggest there's a classic tension in parenting between shaping children versus nurturing. It's what the psychologist Alison Gopnik calls the gardener and the carpenter approaches. The gardener approaches the task of raising a child as if they were a carpenter, shaping the raw materials into the thing that they want to see, whereas the gardener approaches it as a gardener would, creating nurturing conditions in which the child can flourish. Gopnik comes down on the side of the gardener. But this tension is reflected in some of the issues that arise in early childhood intervention with children who have developmental problems. In the early days, there were attempts to correct autism deficits, to shape the child into something that we wanted. And now we contrast that with recognizing that some behaviors that look dysfunctional to us or that we find disturbing are actually adaptive strategies that we should accommodate rather than remediate. As our friends in the neurodiversity community are now reminding us. This is also an issue for services with other disabilities like young deaf children. So we need to know more about what the long-term impacts of these different approaches on development are. Another question is, what are the active ingredients in effective early childhood intervention practices? Active ingredients is a term borrowed from medicine and refers to the chemical compounds in medicine that are biologically active and are actually having an effect upon the body. In human services, active ingredients are the features of interventions that make a meaningful difference in outcomes for children and families. In psychotherapy, these are known as common elements. The recent Lancet Commission on the Future of Care and Clinical Research in Autism concludes that we know little about what are the active elements or mechanisms in our interventions, whether they are behavioural or neurobiological. So this is an area that further work is needed on. What are the causes of different developmental disabilities is another major research question. We understand the causes of some disabilities, chromosomal abnormalities, infections, and so on, but not others. We need to know more about the causes of some of the common neurological disabilities. And I'm particularly interested in the possible role of environmental toxins. And it raises the question of prevention. Early childhood intervention is an intervention activity. It seeks to intervene early in the sequence after a problem has occurred. But what can be done to prevent problems occurring in the first place? That depends upon understanding the root causes of the issue in question. So now on to the practice agenda. What are the issues that face practitioners that we need to be thinking about? First, we need practice frameworks and guidelines on how to deliver best practices. We've got to set best practice guidelines for the sector in Australia, but we don't have a comprehensive set of guidelines that sit behind them and that show us how these translate into practice. A practice framework integrates empirical research, practice theories, ethical principles, and experiential knowledge in a compact and convenient form that helps practitioners to use the knowledge and principles to inform their everyday work. That's what we need. We need practice frameworks for various aspects of early childhood intervention service delivery, such as enabling evidence-informed decision-making. Another practice area that we need work on is how to promote relational skills and adult coaching skills. Like all other human services, early childhood intervention services are quintessentially relational, dependent upon the quality of the relationship between parents and practitioners. Therefore, practitioners need training in the essentials of effective relationship and partnership building, and parents also need support to become effective partners. Good relationships are a necessary but not sufficient condition for effective services. We also need to be able to build parental skills, and therefore practitioners also need training in the use of coaching skills, how to build the capabilities of parents to enable them to provide their children with nurturing and stimulating environments. One of the concurrent sessions in tomorrow's program is a presentation from Stephen Carberry from Noah's Ark, describing Noah's Ark's journey in learning how to use coaching practices. Another practice issue is we need a stronger focus on building attachment and responsive caregiving. In young children, building a secure attachment to caregivers is an essential building block of development, so it should be a key early childhood intervention goal for all children. However, there's a tendency for service plans to focus on disability-related functions, movement and language and social skills, etc., rather than on building a positive relationship between parent and child. Responsive caregiving should also be a key goal, because this can be compromised in parent-child relationships when the child is a problematic partner, because they are slow to respond or find a direct eye contact problematic, etc. We also need to articulate a clear pathway for building child agency and voice. The NDIS is designed for empowered adults in mind. People with disabilities who know what they need to have a good quality of life and can negotiate these needs with professionals and other services. But what the NDIS lacks is a vision of how to get there, of the pathway that people with developmental disabilities follow from birth to adulthood, a journey in which, hopefully, they progressively build agency and voice. This pathway begins in infancy with the experience of participating in two-way interactions with caregivers. Participation of this kind is the engine of development and needs to be a key feature of what we provide children throughout childhood. So we need to identify the ways in which children of different ages can participate in decision-making about their lives and services. Another key practice issue is how to improve ways of helping families formulate child and family goals. In the early stages, at least, parents tend to think in terms of the services their child needs rather than the outcomes they would like to see for the child, themselves, and their family. And the current way in which the NDIS operates exacerbates this tendency. It's in providers' interest to offer direct therapy forms of service. So we need to develop ways of helping parents think first about what outcomes they would like to achieve and then what services they need to help them achieve those goals. And Plum Tree's Now and Next program is an excellent example of how that can be done. Next practice issue, we need to make better use of feedback from parents. The most effective practitioners continually seek feedback about the services they provide, checking how families have experienced the service and whether they are delivering the service in line with best practice. You don't improve necessarily with age. You improve if you get feedback and continuously reflect upon your practice. So we need to develop and use tools and practices that help us get feedback from parents and keep us attuned to family needs. And to ensure that the feedback is honest and helpful, we actually need to engage the families as feedback partners to let them know why we're getting the feedback, and that feedback that they may be afraid to give because it is critical is actually welcomed by us because it tells us what we need to do to improve what we're doing. Another practice issue is that we need ways of identifying and addressing challenging family circumstances. Social determinants, the factors in the world around us, our housing, our finances, etc., have a greater impact on child and family outcomes than the services people receive. That is a salutary finding. In early childhood intervention, the parents' ability to provide their children with the physical and social conditions needed to promote their development will be compromised if their own core needs are not being met. As a result, our early childhood intervention support services will be less effective. So we need ways of learning from families what these issues are. Housing problems or finance or social connection or other issues. And we need links with the wider service system that can help families address these needs. Another service and a practice issue is the need to build a more diverse workforce. We need a workforce that is more diverse and better reflects the populations we're trying to reach. According to the ABS, Australia has 250 plus distinct cultural and language groups, making it one of, if not the most culturally diverse countries in the world. However, the population we are trying to reach are also parents. So it's not, we also need to be thinking about parents as part of the workforce, as peer facilitators. Again, Plum Tree's Now and Next program does this well. We need comprehensive training, pre-service and in-service, that prepares practitioners to deliver best practice services. The NDIS has radically transformed the early childhood intervention workforce by bringing in practitioners who do not always have appropriate experience in training, in working with young children or delivering services. Another effect is there's a much higher percentage of new graduates entering the field, and there's no funded way of training them. So we need to think about how we are going as a system to improve pre-service training. That means how do we engage with the universities who are providing that training, and we need to think about a system-wide approach to addressing the problem of new graduates, how to induct them into effective ways of working with families. And we also need improved ways and training in working with mainstream early childhood education and care service providers, so as to enable them to better support children with developmental disabilities. And of course, the practice issue of when and how to use telepractice. The research question is which form is more effective. The practice issue is which child and family circumstances is it best suited for? And what does best practice in telepractice look like? What are the active ingredients in delivering telepractice? Finally, we turn to the policy agenda. There are a number of issues here that PRECI can actually comment on by acting as a body that can pool evidence and act as an honest broker, as it were, in this space. Here are three big issues I think need to be thought about. Redesigning the NDIS Early Childhood Intervention Service System. We all know that it's not working effectively or equitably for families of young children with developmental concerns, and needs to be redesigned to support best practice and to empower parents more effectively. We also know that the way systems are funded and framed shapes what services professionals provide and what services parents think they need. And that's the issue with the way that the NDIS is currently funded and framed. One of the key issues is choice. It's a central plank of the NDIS, one that we don't think to challenge, but having choice only works when certain conditions are met, and these are not apparent in the current NDIS ECI setup. There's a new book out by Mark Considine analysing Australia's social services, including the NDIS. He suggests that the prevailing economic model of choices and incentive has run its course, has exhausted its possibilities. He suggests that the emphasis needs to shift from choice to voice. An interesting argument. Discussions and debates around the NDIS focus on the half of the NDIS participants who are adults. The other half are children and young people under the age of 18, and they often don't get a mention. There's another concern: the NDIS review panel doesn't include anyone with expertise in early childhood and early childhood intervention services. And I suggest in seeking to redesign the early childhood NDIS system, we need to draw upon the lived experience of parents, and we need to enlist them as co-designers of services and the service system. Secondly, we need to build a tiered system of supports for all families. The NDIS was never intended to be a standalone service, meant to be complemented by a second tier of services and supports. So a universal first tier, a second tier, followed by the third tier represented by the NDIS. But this, in the case of early childhood intervention, this second tier would include supports for families with concerns about their child development, or who are awaiting further assessments of their child needs, or who don't qualify for the NDIS. And the role of the states and territory jurisdictions in providing these second-tier services has not been clarified, with the results that such services are poorly developed or non-existent, making the NDIS the only place to go. It's one of the reasons why it's oversubscribed. What is needed is a tiered system of supports for all families that provides families of children with additional needs with a clear pathways to the supports they need, including the NDIS. So this is an issue well beyond early childhood intervention, but includes the whole of the early childhood and family support service systems. And thirdly, we need to address the conditions under which families are raising young kids. I've made this point before. We've got a good understanding of the conditions that children need to flourish, but are not so conscious of the conditions that families need in order to be able to provide the conditions that their children need. I've made this argument recently in a paper on core care conditions. Families can only meet the needs of their children if their own needs are being met. Just as children need caregivers who provide nurturing and responsive care, so do parents. As Yuri Bronfenbrenner famously said, every child needs someone who's crazy about them. I would argue that every parent needs someone who's crazy about them as well, and we neglect that at our peril. However, there are limits on what ECI and other services can do to ensure that families are provided with the conditions they need to flourish. We can't help with housing issues directly or with financial issues, but early childhood intervention services therefore need close links with other family support services so that they can ensure that those issues are attended. And we also need enabling policies at federal, state and local government levels to address the core care conditions, material and social, that families need to flourish. So, to conclude, the agenda I have outlined is far from definitive. It may serve as a start for a discussion that ECI practitioners and researchers need to have about how they can align their needs and interests. And I ask, what would Janene Swalwell have to say about this research, practice and policy agenda? Well, she will be scrutinising it, see what I might have missed, what might need challenging or refining, and continuing the healthy debates that we've been having for decades about these endlessly fascinating issues. I think she would also be saying, okay, where do we start? Let's get cracking. And that, I suggest, is what we should do. Thank you.